How does thrombocytopenia affect lymphoma blood tests? Thrombocytopenia, which means having a low platelet count, can have a significant impact on blood tests for individuals with lymphoma, especially non-Hodgkin lymphoma. Platelets play a vital role in blood clotting, and when their levels are low, it can indicate that the bone marrow is affected by lymphoma or its treatment. In patients with lymphoma, thrombocytopenia often occurs because lymphoma cells invade the bone marrow, reducing its ability to produce enough platelets. This invasion crowds out the normal cells that make blood, leading to fewer platelets being produced. Additionally, lymphoma can cause the spleen to enlarge. An enlarged spleen may trap more platelets than usual, which lowers the number of platelets that circulate in the bloodstream. Another factor is immune thrombocytopenia, where the immune system mistakenly attacks and destroys platelets. This can sometimes be triggered by lymphoma cells producing substances that harm the platelets. Blood tests, particularly a complete blood count, are routinely used to measure platelet levels. When thrombocytopenia is present, these tests show a low platelet count. This finding can alert healthcare providers to possible bone marrow involvement by lymphoma or side effects from treatments, such as chemotherapy. It is important to note that chemotherapy can also suppress bone marrow function, leading to even lower platelet counts. Thrombocytopenia influences how lymphoma blood tests are interpreted. A low platelet count may indicate disease progression or side effects from treatment. It can also complicate procedures that requiring blood draws or biopsies due to an increased risk of bleeding. Furthermore, if the thrombocytopenia is severe, it might necessitate platelet transfusions or adjustments in treatment to minimize bleeding risks. In summary, thrombocytopenia affects lymphoma blood tests by resulting in lower platelet counts found in routine blood work. This reflects potential bone marrow involvement, effects from an enlarged spleen, immune-mediated destruction of platelets, or toxicity from treatments. Monitoring platelet levels is crucial for assessing disease status, guiding treatment decisions, and managing bleeding risks in patients with lymphoma. Always consult healthcare professionals for personalized medical advice and to understand how these factors may apply to individual situations.